CMS just released some of the important details for 2024 about their Part D plans, and they're really very exciting changes. Number one, we're going to talk in this video about the premium changes that we're going to see in 2024. Secondly, we're going to talk about all the improvements that are coming, and there's several of those, and I'll give you those details. And then lastly, we're going to talk about the fact that now millions of more people are going to be able to qualify for the Extra Help program. I'll explain that program and show you how you can qualify. There are 67 million people today that are on Medicare. And of those 67 million, notice 51 million people have Medicare Part D plans. Now, the reason the others do not is because they don't have to. If someone is able to get their prescriptions to the VA or they're retired military and have TRICARE for life or retired civil service, they have FEHB, they have credible drug plans and don't have to have a Part D plan. But the rest have to have a Part D plan. So there's 51 million people that have Part D plans. Now, as we think about and talk about Part D plans today, I want you to know there's actually two different ways in which people can enroll into Part D plans. The first way is to get what we call a standalone Part D plan. Standalone. This just simply means a separate Part D plan. This is for someone that enrolled in Medicare A and B, and they probably have a supplemental plan or maybe a secondary type of an insurance, and so they have to have a separate plan, and those are called standalone Part D plans for the medications that they self-administer. The second way in which we can get a Part D plan is to get it through our Medicare Advantage plan. Medicare Advantage plan. And so we actually call these MAPDs. So the MA part of this Medicare Advantage has to do with our inpatient and outpatient care. The PD then, of course, is that Part D plan, that prescription drug plan, again, for our self-administered medications. So of the 51 million people, about half have this and half are going to have that. Now, secondly, I want to talk about the premium changes that we're anticipating for the coming year. Now, what Medicare does is they structure their Part D plans and allow plans to change them annually, is they have what we call benchmark plans, all right? And so here's the benchmark plans. Number one benchmark plan is what we would call a basic Part D plan. And this is one that is a Part D plan that meets at least the minimal requirements that Medicare establishes for a Part D plan. All right, and so that's the basic plan. Actually, 25% of all people right now that have Part D plans are on that type of a plan. Now, right now, those benchmark prices for basic plans this year, this would be in 2023, okay, is $32.09 a month. And the average in 2024 is going to go up just a little bit, about $2.40. It's going to go up to $34.50. Again, this would be all of the Part D plans, and this would be really across the country that offer a basic benefit. That's going to be the average premium. Now, as I show you these premiums, this premium could be offset by subsidies from Medicare, from Medicaid. It could also be actually rebated by a Medicare Advantage plan. So it doesn't mean someone necessarily has to pay this. This is just the average basic benefit plan for these 2 years. Now, next, we'll talk about what we call the enhanced plans. Enhanced plans are plans that are going to have a broader formulary. They may have a zero deductible. They may put in some meds that Medicare wouldn't necessarily cover. In other words, they've enhanced it. These are also called alternative plans. In fact, 75% of all people that have Part D plans are on that type of an enhanced plan. All right, and so the benchmarks again for 2023, $56.49, and notice this is actually going to go down in 2024 average price. And so they took all the plans across the country that are determined to be enhanced, so additional benefits beyond basic, and we're looking at, and then these average prices is, of course, less subsidy or less rebates from the Medicare Advantage plan. All right, and so the third thing we want to look at as we talk about premium changes would be the actual market prices, because again, these are simply averages. And so when we talk about actual market prices, this means what are people actually paying out of their pocket. And so what I did to teach you this is I went back and I just picked a Midwest zip code and we looked at the plans within that zip code. And this plan, this zip code actually had 23 Part D plan options, a lot of them. And so as we talk about these premiums, I want you to see these were actual prices. Remember, those were just simply averages. And so what I did, I looked at the first 10 plans of the 23, and they ranged in monthly premium amounts as low as $2.80 upwards to $31.90. Now, as I look at a plan like that, I would tell you that that is a good drug plan. It's a good drug plan. Probably has 2,500 medications in the formulary. If someone's taking 5, 6 meds or less, this would probably be a good plan for them. There could even be some brand name medications in that formulary. Now, of the 23, so 10 are the good plans, and then we have 8 plans, notice 8, that were in a different price point, $32.70 to $58.20. Now, I'd actually would call this a better plan. This just simply means that it has a broader formulary. Here we're going to have more brand name medications in the formulary, probably another maybe 500 to 1,000 more meds to actually choose from to get your meds covered. And so again, this is probably going to be about, I'd say, 60 to 70% of all people will be fine on a good plan, and then on maybe another 20% or so are going to need that better plan. And then of those 23 plans, there actually were 5 that were in these price points, much higher. Certainly these would be enhanced plans, those alternative plans. Some of these would have zero deductible. So the point is, this is going to be also a broader formulary. And then I would just call this the best. And what I mean by that is it just simply means if someone is required to have the very best formulary, meaning they're taking probably 10 or 12, 15, 17 prescriptions a day, and that happens, then they're probably going to need to be in that particular price point, okay? And so we see what the benchmark prices are, some slight changes, and some of these actual prices. Of course, these are 2023. The 2024 plans will not be out officially until October the 1st. And anyone that's on a plan is able to change those from October the 15th through December the 7th. We actually call this the Medicare AEP, which is the annual enrollment period. And then as we get closer to October 1, that's when we'll know exactly what these price points will be. Hey, just real quickly, if you're finding this video to be helpful, you can like, comment, and subscribe. And if you do so, that'll let YouTube know that this is helpful information, and they'll send it out to others who also need to learn about Medicare. Next, I want to get into the really improved benefits that we're going to see in 2024. But I wanted to note, because I think it's very important, that there were also some changes that began this year in 2023 that have affected people. Number one, insulin. Huge deal for people that are insulin-dependent diabetics, because beginning this year, January 1, any insulin that was actually covered by a prescription drug plan had a max copay of $35 a month, which is a huge saving. You're talking some insulins can be $500, $700, up to $1,000 on a monthly basis, but the max copay on a Part D plan now is $35. And the insulin is not subject to deductible. It's not subject to the donor hold, the coverage gap at all. It's a $35 fixed copay throughout the year. So it's a wonderful savings for those that are insulin-dependent diabetic. The second thing that changed for 2023 are immunizations. And this is a big deal. Now, Medicare has covered immunizations for years, since they began in 1965, but it was always hepatitis B shot, flu shot, pneumonia shot, and then COVID. Of course, when that occurred, they started covering the COVID shot, and all those were at zero cost share to the Medicare beneficiary. But beginning this year, what they did, they started covering adult immunizations, okay? And the big one would be the diphtheria, tetanus, and pertussis shot, as well as shingles, the Shingrix vaccination. And so all these now are also at a zero copay. Those vaccinations were covered before 2023, but there was usually a deductible and oftentimes a copay that the Medicare beneficiary had to pay. And those are now eliminated. So we get all those adult vaccinations at zero out of pocket. So it's a great improvement in 2023. Now let's look at the 2024 changes, because they're really nice as well. So the first change that we're seeing for 2024 is what we refer to as premium stabilization. In the past, we have seen drug plans from one year to the next raise their premiums 200%, 300%, and that was just really not uncommon. But now they can't do that. So beginning this year, January 1, 2024, if a company is going to raise its monthly premium on their plan, they will be limited to a 6% increase annually. And that's it. All right, so what is that going to do? That's going to bring some premium stability to the Part D plans beginning January 1. A second change would be price concessions. And this too is a big deal, because what happens, a Part D plan in the past has always had the right to be able to negotiate with a pharmacy, and they could get reduced prices when certain conditions were met. But they were not forced to pass on those reduced prices, those price concessions, to the consumer. That will no longer happen after January 1, 2024. 2024. So if a Part D plan gets a reduced price from the pharmacy, they have to pass that price savings on to the Medicare beneficiary, which the result is going to lower the out-of-pocket cost for anyone that's on Medicare plans. All right, so that's a great change. And then number 3, cost sharing in phase 4. Now, just so you know, I don't have time in this video to go through all of the phases that are on Medicare plans. If you're on Medicare, you may be familiar with this. If you're not, Medicare does have 4 phases this year. Next year, we'll also have 4 phases. That just simply means that as you get prescriptions filled, you move through the phases based upon the retail cost of your medications. And by the way, you can click up here and you'll see a video where I give you all the details of that. You may want to watch that. But my point is this. We still have 4 phases in every drug plan this year and in 2024. Now, in 2025, we'll only have 2. In fact, the cap on out-of-pocket spending in 2025 for prescription drugs will be $2,000. That's it. And not only that, you can also spread the $2,000 out over the entire year. So it's a great change in 2025. But for now, we still have 4 phases. But here's what's happening. The phase 4 of the drug plans, remember there's 4 of them. It's deductible stage 1, initial coverage is stage 2, the donut hole or coverage gap is stage 3, and then the 4th phase is called catastrophic. Catastrophic. Okay. Now, a lot of people don't get to the catastrophic phase. Now, those that are on real expensive meds always do at some point in the year. But let me just give you a quick example. I have a client right now that takes a $16,000 a month medication. They are in catastrophic stage after 1 month, okay? And then for the rest of the year in catastrophic stage, this gentleman has been paying 5% copay or coinsurance for that $16,000 a month medication. And so what's 5% of $16,000? $800 a month. Okay, now moving into 2024, the phase 4 catastrophic is going to a 0 copay. So what he has been paying $800 a month, he will no longer have to pay. And so again, catastrophic phase will be there, but we're reducing it now to a 0 out of pocket for anyone who reaches that phase. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And then the last exciting change has to do with what we call LIS, which stands for Low Income Subsidy. This is also called the Extra Help program. And so that program, notice the word here, is going to be expanded. So let's go to the next slide. Let me show you exactly how this program is being expanded and to see if you can qualify or not. Number 1, so when we talk about extra help, these are officially called Medicare savings programs. And these have to do with people who qualify to get their Part B premium paid for, their Part D premium paid for, and reduced prescription drug cost, meaning out-of-pocket expenses. So if they qualify, there's some wonderful financial benefits if they do. So here's the way the system works. First off, they're going to look at 2 things. They, meaning the federal government's going to look at 2 things. They're going to look at your income and your assets. Income and assets determine whether or not you qualify for this Medicare savings program. So the income numbers that we look at are always based upon what is called the federal poverty level. Federal poverty level. And these are numbers that are published every year. By the way, we don't have the 2024 yet, but we do have the 2023 federal poverty level. And so what I have here before you is $14,580, and that would be for anyone that is single, all right? And this would be 100% of the federal poverty level. If someone is a couple, combined income, $19,720. Okay, so this is basically the base amount that we start with is always the federal poverty level. Now, look at this. So what happens is this. We find out if we qualify for this extra help program, also based upon not just income, but also assets. Now, there are a few states, I'll tell you about those in just a minute, that don't look at assets to determine whether or not you qualify for the extra help program. Most are going to. And so I'm going to read something to you just real quickly. I think this is a very good description of the assets that are looked at. Number 1, this article says assets for Medicare savings programs are resources such as savings, checking accounts, stocks, bonds, mutual funds, retirement accounts, IRAs, 401ks, and real estate, okay, other than your personal residence. So let me say it again. Assets that are going to be in these numbers savings, checking accounts, stocks, bonds, mutual funds, retirement accounts, IRAs, 401ks, and real estate other than your primary house. It goes on to say, in all states, there are certain resources that will never be counted in these numbers here. So let me give you the list real quickly. Number one, your primary residence. Okay, it's not going to be counted. One car, off limits for counting. Household goods, including wedding anniversary rings, burial spaces that you own, burial funds up to $1,500 per person that you've set aside are not counted. And any kind of a life insurance policy that has a cash value of less than $1,500 would not be counted either. So when they look at those assets, here's what the numbers are. This would be for a single person. So if we're below the $10,590 threshold, again, and the income thresholds, we're going to qualify. If it's a couple, you can have assets, the countable ones, up to $16,630. So we want to stay below that number, and therefore we may qualify. So my whole point is they're going to look at income and assets. Now, there are some states that don't look at assets at all, and I just want to read those to you real quickly so you're clear. The states that don't count assets for qualifying for Medicare savings programs are Alabama, Arizona, Connecticut, Delaware, Louisiana, Mississippi, New Mexico, New York, Oregon, Vermont, and the District of Columbia. They don't count assets. Now remember this, these are the federal guidelines. Most states follow that, some don't. So some states could have actually higher income limits, higher asset type limits, but this would be the federal guidelines. Okay, so those are the qualifiers for the Medicare Savings Program. I do also want to mention this, that if you live in Alaska, the federal poverty level numbers are actually 25% higher. If you live in Hawaii, they're 15% higher. But all the other 48 states, this would be the number. So how do we qualify for the Medicare Savings Program in 2023? The number they're looking at, again, is the federal poverty level. And so a person that is no more than their income, that is no more than 135% of the federal poverty level qualifies for extra help. 135% of that number here. Now listen, I don't know what the 2024 federal poverty level is. That number is not out yet, so I'm just going to use that for our number moving forward. It'll probably be a little higher than this, but the point is they're looking at a percentage of the federal poverty level. So what I did is I broke it down for you on a monthly basis. So you're for a single person, 135% of that federal poverty level is $1,640 a month. That's the most you can make an income. So if we're below the asset level and we're below the income, then you qualify for extra help. And you're going to be able to get your Part B paid for, your Part D premium paid for, and low cost sharing on your medications. All right, if you're a couple, the income level, notice, $2,218. So as a couple, if you're combined below that, then again, you're going to qualify for the extra help. So here's what's changing though in 2024. They're actually going to bring more people in to make it easier to qualify for extra help. So they're raising that limit now to 150% of the federal poverty level. And again, I don't know what 2024 is going to be, so I just took 150% of this year's numbers. This will be a little higher, I suppose, next year. But now a single person, as long as they're below $1,823. Now they'll qualify. A couple as long as they're below $2,465. So they say millions more are going to be able to qualify for extra help, which is really wonderful to be able to offset some of those expenses. And so the whole goal of this is to make sure that people get their medications and get the health care that they need.